Hello doctors, welcome back to the NEET MDS 2021 recall series. In this video, we are going to see about a special syndrome, that is Crouzon syndrome, which was asked from oral medicine subject. So here you can appreciate a baby which is looking very cute, but the sad part is that this baby is suffering from Crouzon syndrome. So what is Crouzon syndrome? It is an autosomal dominant genetic disorder. It is also known as brachial arch syndrome. So because it is where the defect lies. So the defect lies in the brachial arch. So it is also known as craniofacial dysostosis. So it is because you can appreciate from this image that the main part that is looking deranged is on the cranium, right? So specifically, this affects the first brachial arch, so which is the precursor of the maxilla and mandible. That is why it is very much important to the dentist. Okay. So coming to the causes. So the causes are fibroblast growth factor receptors, FGR, FGFR2 and FGFR3 are the leading factors in causing the autosomal dominant Crouzon syndrome. Then coming to the signs and symptoms. So a defining characteristic is craniosynostosis. So we have seen craniosynostosis, which results in abnormal head shape. So what is craniosynostosis? It is nothing but abnormal fusion of this sutures. Okay, so it presents in the combination of frontal bossing and trigonocephaly. Trigonocephaly is nothing but fusion of metopic suture. So metopic suture is here, the fusion of metopic suture. It results in trigonocephaly and brachycephaly. Brachycephaly is fusion of coronal suture. Okay. Then dolichocephaly, fusion of sagittal suture results in dolichocephaly. Okay. Then plagiocephaly, unilateral premature closure of the lambdoid and coronal sutures. So lambdoid suture is this one. Okay. When there is unilateral premature closure of lambdoid and coronal sutures, we see plagiocephaly. Oxycephaly, fusion of coronal and lambdoid sutures. Okay, when there is bilateral, it is oxycephaly. When complex craniosynostosis, premature closure of some or all the sutures. So these are the combinations with which it's present. So some infants have trigonocephaly, some brachycephaly, some dolicho. So it depends upon the premature closure of which of the suture that is getting prematurely closed. So the patient exhibits symptoms based on that. Okay. So yeah, so you can see, appreciate from this image. So the main sign here you can see is exophthalmos, that is eyes coming out of the orbit. Okay, hypertelorism, Citicorina is nothing but beak-like nose. You can see this here. Other facial features that are present in many cases include external strabismus and hypoplastic maxilla. Hypoplastic maxilla is important for you. External strabismus is on the ear. Then, so here you can see the person with Crouzon syndrome exhibiting dental anomalies. So the dental anomalies which are present in Crouzon syndrome are narrow and high arched palate because of the early closure of the maxillary sutures. So we can see narrow and high arched palate, posterior bilateral crossbite. So in this image you can appreciate posterior bilateral crossbite. Hypodontia is nothing but missing of few teeth, okay, due to maxillary hypoplasia. People with Crouzon syndrome generally have a considerable permanent underbite. So permanent underbite you can appreciate from this image, also, right? Permanent, like underbite is there. Okay. So the diagnosis, so you can appreciate a radiographic image here. So the diagnosis is based on the radiographic image along with it can usually be assessed by birth. So okay, because of the physical appearance that the infant shows from birth. So the radiographs, MRI scans, genetic testing and CT scans are some which we use to confirm the diagnosis. And the skull radiograph shows increased digital markings, that is beaten metal pattern. So the beaten metal pattern, you can see, appreciate that here. So this is what here the skull is looking like someone has beaten the child abusively, and so it is the beaten metal pattern. You can also appreciate the uh, palette here, like high arched palette, you can see. Okay, so the treatment. So coming to the treatment, surgery is typically used to prevent closure of sutures. So the main problem is closure of sutures in Crouzon syndrome. That is why surgery is used to prevent closure of sutures prematurely from damaging the brain's development. And once treated for the cranial vault abnormalities, Crouzon patients generally go on to live a normal lifespan. So there is no problem with the lifespan once they are treated according to the sutures. Okay. Then coming to the question they have asked in NEET MDS 2021 exam was, they gave an image like this and a child presents with a brachycephalic skull. So we know that a Crouzon syndrome child can present with any type of skull. Okay, so a high arch palate, okay, a narrow maxilla, so as shown in the arrow, narrow maxilla, and hypertelorism. So identify the condition, and the options they have given were Treacher-Collins syndrome, Crouzon syndrome, cleidocranial dysplasia, and Gardner syndrome. So this is a skull. So we are just going to go through the options once. So the skull is looking like this. So from the skull you can appreciate a few points, right? So this is fine, okay, but there is a problem with the maxilla and mandible. So there is an overgrowth of maxilla and mandible, right? So this kind of skull, is seen in Treacher-Collins syndrome. Okay, then coming to this. So here you can see the sutures are broad. So here the sutures are broad, right? That is, they did not fuse and they are broad. There are large fontanelles persisting into adulthood. So this is an adult skull, right? You can see that from the vertebrae and also from the growth of the jaw. Okay, then numerous Wormian bones and numerous unerupted and supernumerary teeth are seen. So this is the only teeth that have been erupted, but there are unerupted teeth over here and over here also. So what is this? This is nothing but cleidocranial dysplasia. Okay, then coming to this. So what all you can identify from the skull? So yes, in here also there is an abnormality in the jaws, right? And there is also a few abnormalities in skull, right? So this is nothing but Gardner syndrome. Gardner syndrome is the three things like intestinal polyposis and all, right? So this is how a skull in Gardner syndrome looks like. Okay. So those skulls were given just for you to remember the way they look, so that you can easily arrive. You can easily arrive for an answer for a Crouzon syndrome skull. So this is a Crouzon syndrome skull. So you can see the beaten metal pattern here. So the answer will be Crouzon syndrome for this question. Okay. So if you like our video, do subscribe to our YouTube channel. You can also follow us on our Instagram handles at Dogshala for dental content and at Dogshala Medical for medical content. You can also follow us on Telegram. Thank you.